Hello, wonderful staff of the Northwest Kidney Center. Today we're going to talk about bedbug infestations. Why in the world are we learning about bedbugs when we are dialysis providers? Well, there may be a dialysis unit in our area that is dealing with this problem, but I am neither confirming nor denying this. I will say, however, that I was asked by a dialysis unit to give an in-service on this important topic as a public service announcement. And even if none of our units is currently dealing with bedbugs, being familiar with bedbug infestations, I think, is important general knowledge for life. Because I guarantee you that all of us will deal with bedbugs at some point. I will share with you that our unit in Kent had a bit of a bedbug problem a few years ago, and it was deftly resolved with prompt recognition on the part of our excellent staff and adherence to infection control protocols. Anyhow, being familiar with bedbugs, important not only for dialysis unit but for your homes as well. I guarantee you that some people watching this video have bedbugs currently. Bedbugs are everywhere, and most infestations are acquired through travel. So if you've traveled anywhere and you brought your suitcase into the hotel room and out, then you probably have been exposed to bedbugs. As an aside, outpatient dialysis settings are not particularly hospitable environments for bedbugs, and therefore the risk of infestation in a dialysis unit is low, but it obviously happens and it needs to be recognized and addressed. The objectives of today's talk include to understand the biology and life cycle of bedbugs, recognize the clinical presentation of bedbug infestations, and review treatment and prevention options. Many of you are probably familiar with the expression, good night, sleep tight, and don't let the bedbugs bite. This is a quote from a book published in 1896 called What They Say in New England, a book of signs, sayings, and superstitions. Let's review the anatomy and life cycle of bedbugs. Bedbugs are parasites, parasitic insects. They feed on blood usually at night, unless of course you have teenagers at home who sleep all day long, in which case bedbugs will feast during the day as well. They are classified under the order of Hemiptera in the family Simidae. And unlike other members of the Simidae family, these are obligate blood feeders who do not remain on the host to complete their life cycle, but instead hide in their surrounding habitat. They prefer human hosts, but they can also suck the blood of other animals such as dogs and cats. Fossils found in Egypt show that bedbugs have been known as human parasites for at least 3,500 years, almost certainly a lot longer than that. Despite being nearly eradicated in developed countries after World War II, infestations have increased since the 1990s, and now bedbugs are widely distributed in all regions of the globe, including developed nations. There are many factors contributing to this, including increased immigration, international travel, the ban of certain pesticides, and increased resistance to pesticides still in use. The correct morphologic identification of bedbugs is important for implementing proper control measures. Bedbugs are flat, they're reddish brown, they have oval bodies, similar in size to a dog tick, so they're very, very tiny. Their eyes are widely separated. They have vestigial, non-functional wings, although bedbugs cannot fly. And if you see a flying bedbug, you have likely misidentified it. They have a plate-like structure covering their thorax. It's concave where it connects to the head, and there are little bristles on the side of the margin of this plate-like structure. The antennae have 4 segments, with the distal 3 segments being long and slender. The abdomen has 11 segments that expand during feeding and expose an intersegmental membrane. Adults range in size from 5 to 7 millimeters, while nymphs, which are the juveniles, may be as small as 1.5 millimeters. Prior to a blood meal, adult bedbugs are brown in color, and after feeding, the color becomes more dull red, and the body of the bedbug elongates and is no longer flat. Smaller nymphs are translucent prior to feeding and become bright red after feeding. The life cycle of bedbug consists of eggs progressing to 5 stages of nymphs, and then finally an adult stage. Bedbugs lay about 1 egg per day, and the eggs hatch in 4 to 10 days. Nymphs undergo 5 nymphal stages, each requiring a blood meal before molting to the next stage. The average lifespan of a bedbug is 6 to 12 months, although they can live up to a year and a half. Bedbugs spend the majority of their lives hiding in little nooks and crannies or harborages. These can include, cracks and crevices of the mattress, cushions, bed frames, and other structures. They particularly like to hide during the daytime, and they come out at night when someone's sleeping in the bed. They also aggregate in groups. So there are certain aggregation pheromones that they produce, and this results in clustering behavior. You can have solitary bedbugs, but most of the bedbugs are found in aggregates, and that's thought to maybe protect them against drying out or desiccation. And there can be many aggregation sites, and so that contributes to the difficulty of eradication. Bedbugs can survive extremes of temperature all the way down to 10 degrees Fahrenheit up to 122 degrees Fahrenheit. Bedbugs are present throughout the world. There's some subspecies, C. lectularius, which is found in the temperate climates where we live, and then there's C. hemipterus, which is prevalent in tropical climates, although with travel now there's a lot of overlap in their habitats. Infestations historically have occurred in more economically disadvantaged areas, but now also occur in sites frequented by travel. So even fancy hotels, fancy homes can have bed bugs. And bed bugs can spread more easily within multi-family or institutional buildings like nursing homes, adult family homes, particularly when people move from room to room. Bed bugs have been increasingly identified in office environments, although spread within the environments is often limited. There have been lots of reports of bed bugs at dialysis units, although as I mentioned earlier, dialysis units are not the best or fruitful places for bed bugs to establish a foothold. Let's now review the clinical manifestations of a bed bug infestation. So bedbugs are attracted to humans, and there are 2 known triggers. One is warmth of the human body, and the other is the exhalation of carbon dioxide. And so when you lie in bed, you sleep at night, and you exhale carbon dioxide, your warm body and the presence of carbon dioxide are strong attractions to bedbugs. The bedbugs climb on top of you in the middle of the night wherever your skin is exposed, and they inject a chemical that basically is an anticoagulant, and it facilitates the aspiration of blood. Bites typically occur on the face, neck, hands, and arms, basically wherever skin is exposed. It takes about 5 to 10 minutes for a bed bug to feast, and you can see over the course of time how the bed bug becomes a darker red color and elongates during feeding. Adult bedbugs, however, can survive up to 1 year without eating. Some people have no reactions to bedbug bites. So you wake up in the morning, you have no rash, you have no bite marks, and you go about your day oblivious to the fact that you were being eaten during the middle of the night. Other people, particularly young people, tend to have more vigorous immunologic reactions. And so the classic appearance of a bedbug bite is a 2 to 5 millimeter erythematous papule, or little bump with a central little hemorrhagic spot, and they can be very pruritic. So a lot of people wake up and they think they've been bitten by fleas, but in truth they were bitten by bed bugs. And this linear pattern of biting is very common. Could have either been a single bed bug that was feasting along this way, or could have been multiple bed bugs. Occasionally people can get blisters at the site of bedbug bites, or they can also get what are called urticaria, or hives, like when you're having an allergic reaction, and as seen in this picture here. Typically the reactions are present when you wake up in the morning, but there can be delayed reactions that occur up to 10 days after the bite. As I mentioned earlier, a linear series of bites is very typical for bed bugs, although sometimes the bite bites are not linear, but that's something to look for. Untreated bites usually go away after a week, but in the meantime, you can be bitten again and again, and so you can accumulate bite marks at different stages of healing. Occasionally, bedbug bites can become secondarily infected, and this can result in a skin infection. It can be impetigo or something called cellulitis. And these excoriated infected areas may take several weeks to resolve. Extreme infestations, characterized by multiple feedings over a prolonged period of time, can result in anemia. And rarely bedbug feeding results in anaphylaxis. Okay, here's a scary fact for you. Bedbugs have been shown to carry other infections, that they acquire from feasting on human blood. And these can include hepatitis B virus, a horrible parasite endemic in South America called Trypanosoma cruzi, which can cause heart failure or cardiomyopathy, methicillin-resistant Staph aureus or MRSA, Francisella tularensis, which is a cause of tularemia, among other potentially severe infections. That said, there's not been a documented case of transmission of these other diseases as a consequence of bedbugs. So there's not clinical evidence that bedbugs are vectors for other human disease, although in theory it is possible. So how do we diagnose a bedbug infestation? Well, it's generally diagnosed based on the clinical presentation, so bedbug bites, reaction to the bites, as well as detection of bedbugs in the patient's environment. When to suspect a bedbug infection? Someone has a pruritic skin reaction, particularly characterized by red papules or erythematous papules or wheals. The detection of new skin reaction when you wake up in the morning wasn't there the previous night. The skin reactions, again, are often in a linear configuration, so you often see a line of erythematous papules. And someone who has a potential exposure to bedbugs, so someone who recently traveled, or they live in a group home or a building with a known bedbug infestation, or there are other people at home who are sharing the same residence who have similar symptoms. To confirm the diagnosis, you have to see the bedbugs. If you can't see them, you can hire a pest control service. They're very good at finding them. Or you can place little CO2 emitting traps. Believe it or not, there are even trained bedbugs detection dogs, and that's because there's a certain scent that is associated with bedbug infections. Bedbugs are mostly found near feeding sites, so in a bed or a sleeping area, but they can be found in other locations, couches, for example, in the living room. Small infestations are often difficult to detect, but sometimes you can see little specks or feces of blood found in the linens, mattress, or behind wallpaper. Bedbugs molt their skeleton, their exoskeleton, so you can find the cast skins of molting bedbugs, oftentimes in the corner of rooms. And as I mentioned a little bit ago, bedbug infestations can produce a recognizable pungent odor that also supports the diagnosis, and that's the basis on which certain dogs are trained to smell out bedbug infections. Now, not all arthropod bites are bedbug infections. So, there's a differential diagnosis. For example, fleas, scabies, among other arthropods, can cause bites similar to the ones caused by bedbugs. And of course, in dialysis patients, we often see something called prurigo nodularis. And this is a very common chronic skin problem in dialysis patients, although they tend to have very firm nodules that persist for a really long time. So they don't just pop up overnight and then disappear after a few days like the papules seen with bedbug bites. After you've diagnosed a bedbug infestation, how do you manage it? So most bedbug bites spontaneously resolve and usually don't require any sort of medical treatment. Although significant pruritus, so itchy skin, is really, really common, in which case we sometimes prescribe some topical corticosteroids or an oral antihistamine such as Benadryl. Of course, it's important for patients to maintain good hygiene. Don't scratch the infection because that can contribute to a secondary bacterial infection or cellulitis. If they develop a secondary infection, that would be an indication for antibiotics. The most important part of managing a bedbug infestation is eradicating it, getting rid of it from your dialysis unit or from your home. And of course, this is difficult because, as I mentioned earlier, bedbugs like to aggregate, and there can be many different aggregation sites. So if you miss one, if you miss one bedbug, frankly, you will have a whole family within a week. So it's very important to take this seriously, and if you need help, contact a pest control management expert. Different ways of eradicating it. Probably the best ways are isolation of contaminated materials like the bed sheets or pillows or something like that. Something called heat treatment, and then also freezing. So what is heat treatment? Well, bed bugs are killed at a temperature of 50 degrees centigrade or 122 degrees Fahrenheit. There are some pest control companies that actually come into a residence and heat the entire residence up to 120 degrees, and that just kills everything. It kills the eggs, it kills the nymphs, it kills the adult bed bugs, and it doesn't really do anything to the house contents. More practically, you can use a hairdryer. So most hairdryers can heat up to 140 degrees. Some can heat up to as high as 200 degrees. And so if you take a hairdryer and you run around the edge or the margins of your mattress where the bed bugs are likely to hide, that's a very good way of killing the eggs and any nymphs or bed bugs that are hiding there. Now, physical removal of bed bugs, can reduce the severity of an infestation, but it's very hard to completely eradicate the infestation. As I mentioned, if you just leave one bed bug, you'll have, 7 within a week, and then a population that will grow exponentially thereafter. You can use, a little plastic card or a paint scraper to run along the edge of a bed or a couch or something like that to look, see if you can scrape any out. It's a good idea to launder your bedding probably once a week if you can do that. And you want to launder it on high heat because the heat is what kills the bed bugs and their eggs. You can also freeze your bedding. So if more convenient, you can take all your bedding out, you can put it in the freezer for 4 days, and that will kill the bugs and the eggs. Insecticides were once very effective in getting rid of bed bugs. That's why they were under control in this country for so many decades, but now there's a really limited role because most of the bed bugs have developed resistance to the common insecticides that are used. Let's now review the Northwest Kidney Center protocol for managing a suspected bed bug infestation. So if a patient comes in, you see a bed bug crawling across their clothes or on the chair, what you want to do is put the patient at the end of the row in contact precautions. Use the clear screens to set up a boundary around the chair, just as sort of a visible reminder that we're isolating the patient. Hang up a contact precaution sign and put a PPE table on the front of the chair to remind staff of the precautions. Cover the chair with a disposable blue sheet. Hopefully patients bring in minimal belongings, but if they bring stuff in, you want to put it in a double bag, tie it off, and don't open it until the patient has exited the clinic. At the conclusion of the dialysis session, of course, we have to clean the station. You want to wear PPE. You want to first remove the disposable blue sheet, roll it up carefully, and place immediately in a dedicated trash. The protocol says specifically, do not shake the blue sheet. If, for some reason, you are inclined to shake the blue sheet that has been covering the chair of a patient suspected to be infested with bed bugs, I suggest that you find employment elsewhere. You want to open the chair sides, and then you want to steam the chair with a steam cleaner, specifically focusing on the chair seams. Okay, that is where they're likely to hide. Then you want to vacuum all the chair seams and surrounding areas and empty the vacuum in dedicated trash. You want to wipe down the chair with the Oxivir wipes and then the surrounding area and allow the chair to dry for at least 10 minutes. Then you want to wipe the outside of the steam cleaner and the vacuum cleaner with the Oxivir wipes, and then remove PPE and dispose in dedicated trash. Isolation status basically is important to maintain until you're pretty sure the patient's no longer bringing any bugs. Although remember, we can do everything right. We can, follow the protocol, but if the patient does not treat the bed bugs at home, then reinfection will likely occur between the subsequent dialysis sessions. So education of the patient regarding the importance of eradicating the infection at home is very important. Okay, let's review what we've learned today. Bedbugs are blood-feeding insects that inhabit human dwellings and may cause skin reactions in humans. Their distribution is worldwide because of travel and immigration. They love to inhabit cracks and crevices of mattresses, cushions, bed frames, and other structures. They are attracted to the host by warmth and carbon dioxide. They generally feed at night while the victim sleeps. Skin reactions vary. Some people have no reaction to the bites. Other people develop itchy little bumps or papules. Some people have hives. Some people have bullae. And rarely there have been case reports of anaphylaxis to bedbug bites. Reactions are typically noticed when the person wakes up, but sometimes it can take several days before the reactions develop. A classic distribution of bug bites is in a linear array, but this is not always present. The diagnosis really is confirmed by finding bed bugs in the patient's environment. And management in a dialysis unit, as well as at home, consists of isolating the patient, bagging of personal articles, heat therapy, say with a steam cleaner or at home, a blow dryer, using disposable blue sheet, cleaning of the dialysis chair with Oxysphere wipes, and vacuuming, all while wearing personal protective equipment. Remember, you can get bed bugs from your patients. I mean, little bed bugs, if they're on the ground, they can literally stick to your shoe and you can bring them home. Or if they're in contact with your scrubs, I mean, they can hold on to scrubs and you can bring them home to your family. And then finally, strongly encourage patients to treat their bed bugs at home. If you don't treat the underlying problem, then they will continue to bring bed bugs back to our dialysis unit. Okay, time for the monthly quiz. It's an assessment of whether or not you are paying attention. Question number 1, when do bed bugs typically attack their human hosts? That's right, at night. As I mentioned earlier, though, if you have teenagers who sleep all day long like mine, they can also attack during the day. Question number 2, how long can bed bugs survive without eating? Bedbugs can survive a staggering 1 year without eating. And so let's say no one's been living in an apartment for 6 months and they rent it out. There could still be lots of viable bedbugs in there. Question number 3, what attracts bedbugs to their human hosts? That's right, there are 2 things. So the exhalation of carbon dioxide when you breathe and body warmth. Question number 4, name 3 types of skin reactions to bedbug bites. That's right, some people will have no reaction, some people will develop little bumps or papules, and some people can develop little bullae or hives, urticaria.